Oxygen is contained in a white cylinder. It usually has a paper tag on the side which labels it as oxygen and whether it is full, in use or empty. The regulator has a Botox seal which ensures a tight seal, and this can leak due to the breakdown of the seal, and should be replaced when necessary. The regulator has 3 prongs which need to be lined up with the holes on the oxygen bottle. This should be tightened using the screw on the side, and needs to be finger tight. On the regulator is a pressure gauge which indicates how much oxygen is inside the cylinder. 2000 psi indicates a full cylinder. Okay, as this is a high pressure cylinder and contains a flammable gas, safety considerations include lying this flat on the ground and should only be used in well ventilated areas and kept away from flame. You should also avoid contact with oil, grease and lubricants. Indications for oxygen use include SpO2 levels of below 94%, airway obstruction, respiratory distress, shock, being unable to obey commands, such as with a traumatic brain injury, carbon monoxide poisoning, smoke inhalation, and decompression illness. Caution should be taken for patients who are morbidly obese, are on home oxygen, or have CORD, as these patients should usually be kept at oxygen saturations of between 88 and 90%. There are several delivery devices dependent on the volume required and the use of nebulized medications. You should always use the simplest device and at the lowest appropriate flow rate. For this presentation, we'll be using nasal prongs, which deliver 24% oxygen and should be used at between 1 and 4 litres per minute. To use the nasal prongs, you first need to attach the tubing to the nipple on the side of the cylinder. This should be then turned on using the dial at the top and set to the appropriate flow rate. So I'll be using 1 litre per minute. This needs to be turned on before placing it on the patient. Okay, so the nasal prongs need to be placed inside the nostrils of the patient, and then the tubing goes over the ears. When you finish using it, you take the tubing off the ears, out of the nostrils, and turn the cylinder off, bleed the regulator, and remove the tubing, and then unscrew the regulator from the cylinder.